our final panel today, so we'll go ahead and get started. I'd like to introduce our final panelist today, Ms. Darby Kernan. She is the policy consultant to Senator Darrell Steinberg. Welcome. And also Ms. Deborah Lee. She is a consulting psychologist with the Mental Health Oversight and Accountability Commission. Welcome. Our final panel, Policy and Funding Opportunities. We will hear how legislation championed by Senator Darrell Steinberg, which is SB 1054, will provide funding opportunities for community-based intervention programs as well as early intervention programs and examples of programs funded by the Mental Health Services Act. At this time, I'd like to turn it over to Ms. Darby Kernan.
Hi, everybody. How are you today? I'm sorry I'm at the end, but I'm loud, so I'm positive you can't fall asleep with my voice. I got to hear a little bit of the last discussion, which was really awesome. And I know Mary from our work together in criminal justice policies. And I have to say, I have always found that probation has been at the forefront of really doing innovative and evidence-based programs, and when we've done realignment in public safety, they've really been the leaders in making things successful, and so it was great to hear about everything they're doing. So Senator Steinberg is the president of the Senate, and he's been a mental health advocate for a long time. I would like to tell you a little bit about how he kind of came into what we're doing today with Senate Bill 1054. But last year, the governor had a proposal on the prison capacity because there was a cap and a court order to meet a 137.5 benchmark for our prisons. Senator Steinberg said the governor's proposal was to do that by all, just expanding capacity and buying out-of-state beds. Senator Steinberg and the Senate Democrats opposed that proposal and then worked with the administration on alternatives. And as a result of that, we introduced and passed Senate Bill 105. And 105 basically said if we were to get an extension with meeting the population cap of 137.5 in all of our prisons, then the funding that we were going to use to just incarcerate people out of state, we would take that money and invest 50% of it into recidivism reduction. And so we created a fund of the Recidivism Reduction Fund. The courts granted a 2-year extension, and the governor's budget proposal this year has $82 million in this recidivism fund. And it's expected to go up, actually, after the May revise comes out in a few weeks. So for Senator Steinberg, who has been a strong advocate in mental health issues for a long time, when we got the funding for the recidivism fund, it was like, how do we reduce our prison population? And how do we make a difference? How do we stop people coming in the front door? And how do we make it better for people once they leave prison? And with all of the work he has done with mental health, and he was one of the people who passed Prop 63, which is established the Mental Health Services Act, we started looking at mental health and mental health in our prison systems and in our juvenile systems. And one of the key things, as you see, is that the mental health population in our jails and prisons, they've existed for a long time, but they're increasing. And it's increasing among our juveniles as well. And so one of the things we wanted to do with SB 1054, which is reestablishing what was a very successful program created in the 1990s, the Mentally Ill Offender Crime Reduction Grant Program. And this program started about 1998, I think, was the first time, I think, that it broke down the silos from sheriffs, probation, mental health, substance abuse providers, and it got all of the county people sitting down together and doing preventative work to get people who have mental illness out of the jails and out of the juvenile facilities. And it was really successful. There was research showing that jail population decreased. The number of bookings decreased. People were having less incidents in facilities. And so as we were looking at what to do with the recidivism fund, Senator Steinberg introduced SB 1054. So it puts $50 million of this fund into reestablishing the mentally ill offender grant program. A couple of just good stats that I think, and part of the money, $50 million, $25 million is for juveniles and $25 million for adults. And it's not just for in jails or in probation, but it can be for outside too. And so what the goal is that we provide the services so people do not return, or if they come into as juveniles the system, that they can get the treatment and services they need so they don't graduate to the adult system. In 2013, the probation chiefs documented long stays and high costs related to the detention of juveniles with mental illness problems. 70% of the people in our juvenile facilities had an open mental health case. In our juvenile justice system, DJJ, of the 8,200 juveniles in custody or on electronic monitoring, over 52% have open mental health cases as well. And so the goal of taking this recidivism fund is focusing on those services. And then this is not the best setup here, sorry. I want to tell you a couple of things one of the things that the original grants were used for is the mental health courts. That was one of the things. So instead of sending people to juvenile hall or to prison, they would do diversion and they'd buy programs for them. And so you would get a bed and get treatment instead of having to do time in jail and prison and have your mental illness get worse. Like I said, in the original legislation, there were over 30 collaborative demonstration projects that were created, ranging from all different kinds of things. And I think a lot of the programs Mary talked about, a lot of the funding originated with MyOkra funding to allow different opportunities to use the mental health treatments and the different therapies. So over 8,000 mentally ill individuals in 26 counties received services. And this resulted in a 6% decrease in bookings, 10% decrease in felony bookings, and 8% of convictions reduction because people were being diverted. It also reduced the amount of jail time for people by 5%. So, Senator Steinberg has done a lot of different things, and this is just kind of building on that. Last year, we were able to pass SB 82, which funded about 2,000 crisis beds so that people who are having a mental illness crisis didn't have to go and get incarcerated to be taken care of, that they could be diverted and have a place to deal with that. And we funded over 200 triage workers so that in jails and emergency rooms, people have somebody who can sit, instead of taking someone on a 5150 hold and taking them to juvenile hall or to the jail, they can put them into services. And so those are things we're building on. Realignment has expanded a lot of opportunities where jails are now saying that they have more mentally ill people, and they're looking for ideas and ways to deal with them. And so we're trying to make sure that whatever they do, they can use these funds. It has to be evidence-based practices, and they have to do the research and the data, provide us the data to show the success. So that's what we're doing. Thank you.
Hi, I'm Deborah Lee with the Mental Health Services Oversight and Accountability Commission, here to talk about Prop 63 in the Mental Health Services Act. But before I do, I have to say I'm overstimulated and I'm appreciative because all day I've been here listening to basically what I would say about the Mental Health Services Act told through other lenses. So I've heard through the lens of education and through the lens of probation and through the lens of justice, talking about really the same practices and the same values that I would talk about talking about the Mental Health Services Act. So that's kind of exciting. I guess what brings this together is you could look at it from two perspectives. You have a perfect storm of things like risk or onset of a mental illness, trauma, poverty, involvement in the justice system, school failure. So those kind of things come together. But I think what's more important is we have a perfect sunny day. I have the wrong glasses too, but I can fix that. You have a perfect sunny day of a convergence of talent, strength, resilience, passion, recovery, creativity, and generosity in these amazing youth who are gracing us with their presence. And it's so exciting. It's so amazing. So whatever the lens is, if it's giving opportunities for these amazing, amazing people who are gracing us with your presence to bring your strength and your talent and all the contributions you're making, that's my overstimulation of gratitude. So jumping ahead to the Mental Health Services Act, maybe you all know this, but Darrell Steinberg and others wrote Prop 63 to expand and transform the mental health system, imposing a 1% tax on incomes over $1 million. It was actually the first tax that had passed in California as an initiative for something like 5,000 years. Okay, maybe not that long, but for a really, really, really long time. And there's a lot of fluctuation in the income over $1 million of millionaires, depending on whatever's going on. But in good years, it's generating over $1 billion for expanded mental health services in California. And as I said, there's a lot of overlap in terms of both the need and the approach. So because, as you've heard, most of the people who are involved in the criminal justice system or who are at risk of being involved very, very often either have a mental illness or have risk factors for a mental illness, primarily because of the overlap of trauma. When you're expanding and transforming mental health services, this is one of your priority populations. But in addition to just the overlap in terms of the need and the focus, there's a lot of overlap in terms of how the Mental Health Services Act says that you're supposed to do things. And the first one is collaboration. And I think we've heard today, and it's obvious really, getting back to the perfect sunny day of these amazing youth, people, when we walk out the door, we don't say, I'm a person with a mental health problem, or I'm here because of my educational problem. We're just people, right? We've got all our different facets. And so one of the principles of the Mental Health Services Act is for people to be responded to as people in a whole way, and to build on strengths, and that services should be effective. And as Pam said in her presentation, the quality of how these programs are ranked in terms of effective, there's a difference between how effective a program is and how rigorous the evidence is that it's effective. So sometimes we get those things mixed up. But the Mental Health Services Act says that you need to use effective approaches. And part of what we need to do is to bring to research, as Pam also talked about, and demonstrate in ways that other people will believe what we heard from the youth here today about what is an effective practice. So the Mental Health Services Act says services need to be collaborative, they need to be integrated, they need to be culturally competent, which again is a word that you toss around a lot, but in a state where the majority of people are of color and the majority of youth dealing with these justice systems are of color, having culturally competent approaches is obviously incredibly important. So both in terms of the focus of the programs and in terms of how they're supposed to be delivered, they really fit with everything we've heard today about the best practices in working with and for and being inspired by youth who are dealing with mental health issues and also dealing with justice involvement. Other things that are specific in the law that relate to this, one of the most radical and challenging and exciting dimensions of the Mental Health Services Act is that every single decision that gets made has to be informed by the people who are affected. So clients, family members, people from diverse cultures, as well as people from all those different parts of society that are affected by mental illness, including law enforcement, need to be involved at the county level in the planning and the decision making. And the law was recently amended to say that not only do they need to be involved in the planning, but they need to be involved all along with the implementation, the evaluation, and the decisions about what to keep and what to change. So there's tremendous opportunity in every county for people to be involved in a very, very active way in making decisions about how this money is used and to honor both the local needs and to build on the local strengths. In terms of prevention and early intervention, which is 20% of the money, it says in there that it's there's sort of two parts to the prevention and early intervention section. One focuses on individual people, and that part of the money is for people who are at risk of or have early onset of a mental illness, and it's designed to affect 7 outcomes that happen when mental illness isn't addressed, and one of those is law enforcement involvement. So for prevention and early intervention, it's a very, very specific priority. I did a little study at the very beginning of the first plans that counties did in the first round, and 100% of counties and 100% of counties had at least one program dealing with children or youth from who are dealing with stress. And that amounted to 63% of the programs. Obviously, there's a lot of overlap here because you don't just address one thing. 95% of counties had at least one prevention and early intervention program dealing with the risk of failing at school. And that amounted to 37% of the programs. 76% specifically dealt with youth either involved in the juvenile justice system or at risk of becoming involved, and that was 28% of the programs. And even though it wasn't really required in the Act, 78% of counties had programs that focused on trauma, and that amounted to 50% of the initial prevention and early intervention programs. So this is a very, very major significant focus of prevention and early intervention. The other focus in prevention and early intervention, besides the services for individuals, is basically ways to link people to services and to help people, the kind of things that the youth were talking about earlier about I didn't even know it was therapy until then later I figured out that it actually was, is making it more acceptable for people to get help. And one of the things is to reach out to people who are in positions to identify signs and symptoms of mental illness, which obviously includes people in schools, people in law enforcement, and friends, and people who work at the Boys and Girls Club, and those people who are able to connect other people. So that's another big focus of prevention and early intervention. 80% of the money goes to treatment for people who already have a serious mental illness. It's not quite 80%, but it's approximately 80%. And the focus there is on a kind of program that we call full service partnerships, which is an approach that showed evidence of its effectiveness, and basically it's whatever it takes. It's being able to rally all the resources that are really necessary. to help somebody get better and get into recovery. And there are a number of full-service partnerships that focus specifically on transition-age youth, including one in Sacramento that focuses specifically on transition-age youth involved in the criminal justice system. There's a workforce education and training program component that's designed to expand the workforce, to bring more peers into the workforce. And again, the youth we saw earlier who moved from being participants in the program to the each one teach one, that's the peer thing. So that's one of the focuses in workforce education and training, is to get more peers paid to work in the mental health system, and also to expand the skills of the people who work in the system to work in this kind of way. And there's part of that that is specifically available to people who work out in the community, including in law enforcement or in schools or in boys and girls clubs or, you know, other kinds of youth programs, places that can connect people. And then finally, there's an innovation component. It's the smallest, and it's the one where the basic rule is it can't be an evidence-based practice. It has to be a practice that you don't know whether it's going to work or not. So it's an opportunity for people to try out new things that they're not ready to commit to yet, but they want to develop them and test them and evaluate them to develop the new best practices and then spread them around to others. So in all those areas, there are efforts going on right now that are really very similar to what you've already heard described in the other presentations, but they're being funded as mental health programs. And many of these are in collaboration with other systems. Prevention and early intervention actually requires that the program be done in collaboration with other systems. So they're done in collaboration with schools, or done in collaboration with law enforcement, they're done in collaboration with family resource centers or tribal organizations, but they're done in a collaborative way. I'd love to give you examples. There are so many, but they're not different from what you've heard. They're the diversion programs that try to keep people from getting involved in the justice system in the first place, or diverting youth out as quickly as possible. They're the mental health courts, which are a form of a diversion program. There are all the kinds of treatment programs, individual and family therapy that you've heard about. There's lots and lots of programs that start working with people when they're in a facility, they're in a juvenile hall, and then, but basically are helping them to get out. So they're helping them with that transition and making sure that as they make that transition, they're going into, as the youth said, to a family, to a community, to a connected place, and where the support is there. And there's programs all over the state funded by the Mental Health Services Act that are doing that today. In terms of innovation, there's all kinds of great new things that counties are developing and communities are developing. Just to tell you a few, and some of them, again, you've heard before. There's several programs that are working on developing collaborative approaches both to juvenile sexual offenders as well as people who are victimized by sexual offenders, and often those are the same people. There are transitional housing programs that are for youth that are being led a lot by peers. There's a whole planning process in a county to look at the services where youth are playing major roles in planning, so being involved in the policy level. And all of these approaches are things that are being tried out and tested to see if they work. I think I'll stop there because I have to stop somewhere. Thank you very much.
Thank you. Thank you both for your presentations. Now we're going to go ahead and open it up for questions. So we can get those mics in place. Do you have any questions? There's one back there. Wait.
Hi, I have two questions. For Darby, for 1054, I see that if you look at the legislative language, it places a lot of control within the BSCC.
Yes.
And I've heard from a lot of kind of criminal justice and juvenile justice advocates that it's not necessarily a body that is very reflective of kind of the advocacy community, and there might be maybe one person on there that I've heard, I'm not an expert, but I've heard that the advocacy community really embraces them. So I'm wondering if that's at all a challenge you see. And then for actually both of you, my understanding of MHSA is from several years ago, and mainly from the perspective of community-based providers that really felt that the way the funding streams worked with MHSA, everything went to the county. And in every county, the county is maybe not the best place to be, performing a lot of services. There's like community-based organizations that might be doing a better job. And I see within 1054, there's some of that same language that things flow to the counties. And so, in counties like Alameda County, they're really open to working with nonprofits, but other counties are just not. And so I'm wondering if that's kind of a concern, or if there's going to be language put in 1054 to kind of address that.
So on 1054, with the BSCC, the original MIOCR grant went through the Board of Corrections, which is the new BSCC. There are some really great people at the BSCC. I think they had a slow start, probably is a way to say it, but David Steinhardt and others who are very, Scott Budnick, who is a juvenile justice advocate. There are some really good people there who were on the original MIOCR program and really know about juvenile justice and mental health. And so I feel like they're going to be able to pull everybody in. And we have, the legislature has oversight over the BSCC, so we can always monitor and interact with them. So I'm not as concerned about it being at the BSCC. And, for us, the one thing I forgot to say is that 1054, I thought of like 10 other things I wanted to say, by the way, as soon as I sat down.
Here's your chance.
I know. It's a competitive grant, and so the counties have to apply for the money, but they can work with the community-based organizations. For us, it's a monitoring tool. It's easier. We can ask the counties to provide us information and get that information to us, but they're the ones who also are running the facilities. And so I think it's really important that if we're going to try to divert people from those facilities, that we're all working together. Because if you don't have the courts and you don't have probation and you don't have the sheriff on board or the police, then you're not going to make the difference. Because at any point, those people can not sabotage, but just not help make it all work. And so you have to have the counties on board to do it, to make it successful. And the beauty is that they can contract and work with the community-based organizations.
And to answer your other question, you're absolutely right. The money goes to the counties. And you're also absolutely right. There's a tremendous variation among counties in terms of how much and to what extent they contract out services with community organizations. My impression is that most of them do, and especially for prevention and early intervention, because that's where the expertise lies in the community. But there is a tremendous variation. One of the ways the law has changed, two ways the law has changed since it was implemented. One I already mentioned, there always was a requirement for community planning, and that the decisions had to be made with the input of people with serious mental illness and their families, representatives of diverse communities who are underserved by the mental health system. The planning participants have to reflect the diversity of the county and the involvement of, it says, these various parts of society: education, law enforcement, social services, substance abuse services, veterans. It doesn't say whether those are the clients of those systems or the administrators, but they have to have some administration. So that was there from the beginning, that in terms of the decisions and the planning. That has been strengthened because now, in addition, they have to have a partnership that's continuous and ongoing. So that moved in one direction. But what moved in the other direction is now that the counties, with the exception of innovation, approval of all those programs is at the county level too, where previously approval was at the state level. So really more has moved to the counties. So what that means is that the local advocacy, local stakeholder process, having people involved at the local level, is just absolutely, completely, totally essential.
I would just add too, though, we will be doing more amendments to SB 1054 because we are developing the juvenile justice piece a lot more and making sure the research component and the programs, and that it's not just an adult program and then we kicked in juvenile justice. We really want to make sure that the juvenile justice part is great.
Okay, I understand we have another question over here, and then we'll get to you over here. Oh, excuse me, right here.
Is this training being given to, specifically to administrators and teachers? I got this in an email, and I don't know if I didn't see any teachers and administrators when they asked who was attending this conference. There may be some, I don't know, but is it being, getting this training too?
We did open it up to everyone as, this being our first step to take part in the dialogue. But I believe we did have a few people respond as administrators, but we will definitely take that in consideration as we move forward. There was a question here, and then we'll get to it later.
Darby,
Yeah.
is there any talk in Senator Steinberg's office about the spread of evidence-based practices and going the route that other states have gone? For example, Washington State, Oregon State, Louisiana State now. But they actually have legislation that both identify evidence-based practices and which practices can be delivered, and then also have requirements that private providers and county providers actually deliver those evidence-based practices. And so what they're doing is they're changing the way that businesses are done in their states, but it's taken state legislation in order to do that.
There have been legislative proposals to move to the Washington State model. I believe through the criminal justice system right now, I think it's Pew or PPIC is doing in 7 counties doing evidence-based programs, and then taking all of basing on Washington State and kind of getting down to the cost of running those programs and the effectiveness, and whether you get $1 for your dollar or $400 for your dollar investment. We recreated the Board of State and Community Corrections when we did realignment in 2011, and I think it's very hard for this administration to move away, and the legislature, although it definitely has its critics, a move away. I think it needs time to grow and succeed, and they do evidence-based practices. They're growing their research component, and I think that they have a new executive director. They have a chair who's very dynamic, and I think you're going to see more information and more data coming out of them. But we do, in realignment came with you get the money and you get the population, and you do with that locals. And there was very strong from the counties and law enforcement and probation not to put strings on that, because in the legislature we always want more and give us data and tie strings to all of the money, and really for a realignment to pass and be implemented we weren't allowed to put that in there. And so I think that I think the legislature in hindsight wishes we could have done that more, but I think you're starting to see it. And counties know if they want to get more money, they have to show that what they're doing is working. And Napa's an excellent example of that. They have incredible programs, and so people are more than happy to kind of keep putting it in there and trying to give them more.
And I just want to add to that one more thing to pay attention to, and I don't see this much because I see that when data is collected, it's basically around large system outcomes, but it is rarely around actual functional outcomes of children and their families, or adults for that matter. And so in looking at functional outcomes, you can actually tell whether or not a person is actually doing better as opposed to a system outcome, because just because somebody doesn't live on the street anymore or is homeless doesn't mean that they're actually doing better than they were doing when they were homeless. And we've seen many examples of, data's not perfect. So anyway, more of attention to functional outcomes would be helpful.
I totally agree. And, Senator Steinberg, if he was up here, he'd be going on for much longer than I'm going to go on about that, because he is very much about, he thinks the Prop 63 is the best kept secret in the world, that not enough people know about all of the work that they're doing and all of the prevention that happens. But I do know in Los Angeles County, they're doing some really good data outcome right now where they're showing it's, how many days that person is not homeless, how many days that person is now no longer incarcerated. They're doing some really good things, and it just takes a lot of effort. But I think we're moving in that direction.
Right, and the new PEI regulations that are in development are focusing much more on outcomes and kind of where the state of the art is at this point, which is pretty easy. It's kind of basic. It's not a matter of saying you're going to collect these specific outcomes. It's giving choice about which outcomes which indicators you're going to use. But they do focus on the 7 negative outcomes. So that means direct either reduction of risk of mental illness or reduction of symptoms of early onset, and then looking at the implication of that and as a result of that, improved success in school, less likely to be involved in the justice system, reduced homelessness, specific outcomes for individuals, but having them have a much more clear mental health context and making that connection. So that's the movement, I'd say.
Thank you. We have a question here.
Hi, I'm Sean Rowland. I think it's very exciting that my Okra grant is coming back, but I believe it was quite a lot more money when it was here before. How much was it?
It was in the 200 millions.
That's what I thought, because I was part of the team in Contra Costa County for juvenile. We had 22 million just for our grant, and now you're talking about 25 for the whole state for juveniles. I'm just wondering if there's a thought of some way of making it closer to something that can really make the kind of impact it did before.
If in the May Revise, the recidivism fund comes out and there's a whole bunch more money put in it, then that's an opportunity. For us, it was really about reestablishing it and getting it started again. And what we've seen in the legislature is if we can get these programs up and running again and have that investment there, then it gives us and we get the data back about what it's doing, then we come back and we have the data to say, let's put more in there. But we're still recovering in the budget. And so it's very hard for us to do big amounts of money. Plus, I just want to say, that's the My Ochre piece, right? So that's just the grants. But other things we've done, which is in the mental health arena with the crisis bed and the triage workers, but also through SB 105 last year, we fixed the SB 678 model, which is what if probation is successful in diverting felony probationers from coming into the prison system, they get half our savings. And when we did realignment, that fund dropped considerably, the amount that people were going to get. And so we fixed the formula so it goes back to what it was. And so that increased it by almost another 100 million going to probation or chief probation offices this coming next year. I mean, it's reimbursement, so it's a year behind, but that's the good side of it, is that there's more money coming into the system. But we also lost a lot. With realignment, we constitutionally protected COPS money, juvenile justice money, those dollars that used to be kind of questionable and could increase and decrease based on our funding and what the legislature approved and the governor approved. That is all constitutionally protected under Prop 30 right now, and so the counties get that. They got a whole bunch of other stuff for it. I'm not saying it's all enough, but this is just one more piece. We're also looking, though, and again, so collaborative courts, expanding those so that counties like Los Angeles, which has one mental health court, can open up more and divert people, getting money aside for that. So we're trying, instead of putting it all in just one area, to see what else we can do to kind of invest funds in.
Right, and along those lines, when the act was amended a couple of years ago, it now has a provision that says each county plan and annual update, blah-de-blah, shall consider ways to provide services similar to those established pursuant to the Mentally Ill Offender Crime Reduction Grant Program. So counties can, and many are, providing similar kinds of services using MHSA funds as well. One of the things we might want to think about at some point is trying to kind of bring these things together, having them be a little more coordinated, as well as getting the word out in the way that Senator Steinberg is concerned about, but also getting the word out so more young people and others who can benefit from these programs know about them. Because even though all this stuff is happening and all these good things are happening, most of the people who need these programs don't know anything about them, never heard of them. So, I mean, it's a continual effort to get the word out at all levels and to fund the people who can get the word out from an experiential point of view, which is a whole other deal.
Okay, thank you. We have a question in the back and then one here in the front.
John Flo from Sutter Yuba Mental Health. How you doing? I just have a couple of statements, really. One is I appreciate the fact that the funding is going to the counties because every county is different. We're a rural county in Northern California, 2 rural counties, and what we do in our county and the things that are going to work for us may not work in LA, just like in LA it may not work in our county. So I appreciate the flexibility that's put into the program, and I hope that that's going to stay. The other piece is, remember, I believe prevention was just rolled out in 2009, the funding, if I'm not, well, in 2009, I can tell you what happened. I was hired as a prevention services coordinator for our county, and for 1 year, we told them about all of these great programs we were going to roll out, but we weren't going to be able to do anything until 2010. So for outcomes, I'm speaking towards outcomes, and Pam's comment is that, remember, we're looking at outcomes, not just short-term outcomes, but we're looking at long-term outcomes, and we're wanting to see what program works best for us. So I'll explain a program we used in our 2 counties, which is the Yellow Ribbon Suicide Prevention Program. We rolled that out in all of our high schools, and it took us 2 years to do it. And now those programs are going and thriving. And what we're seeing is an increased identification of suicide and suicide attempts, of call-ins and people calling into our crisis lines, and we're seeing that working. Now, I'd hate to see somebody say, well, I like the pink ribbon suicide prevention program rather than the yellow ribbon. I'm just making that up, and saying this is how you have to do it. I hope that there's going to, maintain some flexibility with the things we've already learned that are working and say, no, you got to stop all of that now and you got to do this other program because it's our candy stick program or because we like it. I'm hoping that you consider that.
I think local control is here to stay. I don't think you have to worry about that one.
And just as far as the direction of, again, the draft regulations that haven't been approved yet, it's totally in that direction. It's taking away any kind of requirement at all about any particular kind of program, and instead putting in a requirement that you evaluate them in ways that make sense to you and that make sense to that particular program. So, for example, for suicide prevention, first of all, if you want to do one, it's optional whether you do one or not.
Right.
But if you do, the only requirement is that you evaluate it in some way that looks at changes in attitude, knowledge, or behavior of whoever it is you're trying to affect in ways that make sense so that you can look at the long-term and the short-term and identify indicators that make sense for you. The hope is over time, we'll take that knowledge and look at it, and maybe at some point we'll agree on some common indicators, or at least a menu of common indicators that people could choose from, just so you can get more consistent information. But I don't think there's any energy that I can see at all to suggest that there would be requirements for specific kind of approaches, but rather instead to provide that flexibility as long as you're demonstrating outcomes in ways that make sense for that program.
Right, and the other thing I'd like to mention is that I like the aspect of flexibility for contracting. We were able to contract with Big Brothers and Big Sisters and bring them in from Sacramento to our community. It's working great. Also, one of our leads on, I call them Army of One, our LGBT focused resource person in developing that particular group's development of a resource in our community, and we were able to start a nonprofit called Got Bliss in our community, which we never had before, and they're the only Gay Straight Alliance group that is focused on helping get resources to our community in that way. So, I appreciate that flexibility also.
Great.
Being able to contract with specific needs.
Great.
And meeting those specific needs. So please don't turn that off.
No, that's not going to happen. Which county? Great.
Thank you. Okay, before we wrap up, this last question here.
Bill Arroyo, Los Angeles. Anyway, appreciate both of your comments very much. But let me share some science with you that I think is really important. First of all, 50%, the onset of 50% of all mental illness begins before the age of 14. And yet, as you know, our community mental health system is really based on serving people after they've jumped over a cliff. And in fact, some of our funding is available when somebody can commit a crime. But before that, that funding is not available. I think we have it a little bit backwards. That's my bias. And the fact remains that we have interventions that can benefit children and families before they break the law. That being said, we've heard from a number of people here that funding is limited, despite the good effort by Senator Steinberg and others. So that brings to mind another pot of funding, and that's the Affordable Care Act. And at this point in time, as we are rolling out the implementation of the Affordable Care Act, there is very little focus on implementing evidence-based practices through the health plans. There's a lot of money there. Communities need much more than 50 million, and we should take advantage of it because we know what works, and people should not have to break the law before they get help. Thank you.
Thank you. Thank you both for your presentations.